In December of last year, the U.S. Surgeon General issued an advisory on youth mental health and how the pandemic hardships have played a role in the emerging crisis.
The advisory highlighted the increased rate of depression and anxiety diagnosed in children, but they aren't the only ones impacted. There's also a renewed focus on parental mental health. Morning anchor and health reporter Kirsten O'Connor is on assignment, so Bridget Ellison is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Experts say the changes in routine for families due to the pandemic can affect parents' mental health while they try to juggle work and keep their kids healthy. We recently spoke to Dr. Monica Barreto, a pediatric psychologist with Arnold Palmer Hospital for Children, about some of the problems parents are facing.
We've talked a lot about the children and teens' mental health, but it's really important to also think about the parents. It hasn't just been, let's say, a month or a couple of months during like school where children are at home and they have to balance work and kids. It's been years. I think lots of parents are not just juggling their personal lives and how they are dealing with all of the stressors over the past couple of years. I work primarily with kids with chronic illnesses, and some of these parents haven't been able to go back to work or have had to, make that hard decision to stay home. In addition, then that leading to financial burden. So I think it's a big piece that's important to start thinking about how can we support these parents and what can parents do for their own self-care, even if it's small. I do lots of parent sessions individually and really teaching them themselves. How do we regulate your own emotions? How do we take short walks, take breaks, separate yourself, even if it's to take 2 minutes, wash your face with cold water, take deep breaths, because they themselves become emotionally dysregulated, and that is normal. We are all human. Parents are as well. The same way a child can become overwhelmed, anxious, and depressed, so can a parent. And for most of them, they have to kind of push through it because they need to take care of those around them. And really, it's okay to take a moment.
And we asked Dr. Barreto about coping mechanisms for parents dealing with financial burdens, especially if they lost their job.
And that's a difficult one as well, because it also impacts the child, because lots of children are listening. So lots of parents are feeling really overwhelmed. Like it's hard to even talk about it because the kids are around. In those moments, really trying to kind of sit down. Lots of parents I've worked with, like, do what you can and what you can control, sitting down and making a budget, looking at it on paper. What does it look like when we're feeling very overwhelmed, whether that's anxious or upset or sad? It's hard to problem solve. So really helping them find those moments where they can calm and sit down, see where they're at financially and what can they do and what can't they do for the moment.
And she says you never know who has information, whether a therapist, a social worker, or a friend. It's important to talk about what's causing your stress and what are signs that your child could be dealing with too much stress.
And I think whenever we notice a change in a child's functioning, if they're usually very hyper and active and laughing and running around, and they're more withdrawn and they're outside of their character, usually those are nonverbal signs that something is going on, whether that's a stressor academically or socially. But kind of, your child, and parents know. I always tell parents, you know them best, and you're teaching me about your child. And really, if we're seeing some change, talking about it.
And as far as parents of little ones, the transition from only seeing parents or immediate family to seeing more new people and places can be difficult. The same can be said for elderly as well, who are isolated. It's important to check in on them as much as possible.